Hey, Dr. Nielsen here. Just wanted to give you a couple of live tips. You know, patients have often heard me say, it's not enough to be in the right doctor's office at the right time. You have to be the right patient in the right doctor's office at the right time. So I want to talk today about empowering you, about doing some trainings, subsequent trainings on about a weekly basis to be able to empower you and help you be the right patient in the right doctor's office at the right time. Today I'm going to be talking about insulin resistance. You've heard of insulin. What is it? It's a hormone. Where is it produced? By the pancreas. Insulin is, the pancreas is down kind of by the stomach, produced by the pancreas. And this insulin, the job of the insulin is to be able to transport blood sugars into the cell. You know, without blood sugars, you won't be alive. The blood sugars are so important. In fact, 60% of the blood sugars in our body, called glucose, you've heard of that, glucose is used by the brain, 60% of that. All the other cells use glucose. And so insulin is so important, so necessary to be able to transport the glucose into the cells. Now, when we talk about insulin resistance, listen up here because this is very interesting. Insulin resistance, the pancreas is producing, the individual is producing the insulin, but consequently the insulin has become ineffective. The process has become ineffective into transporting the blood sugars into the cell. How does this happen? There are four main ways that we'll talk about today. The number one way, age. By getting older, you get insulin resistance naturally. There's some other reasons of why. Number two is genetically predisposed. Number three, the third reason would be hormones. Other hormones in the body causing insulin resistance. The fourth reason, and the main reason I want to share this with you today about insulin resistance, is exercise. Exercise starts with a little EX and ends in size. The importance of exercise. You know, this is so important because, and the reason why I wanted to share this with you, I came across a study just at a seminar this past weekend. It was done by the American Journal of Physiology and Endocrinology and Metabolism. They took 20 healthy young men, 20 healthy, strapping young men, and what they did is they made them be inactive for 9 days. 9 days of inactivity. They had them do bed rest. This 9-day activity, or inactivity I should say, caused over 4,500 different gene alterations. 4,500 different genes it affected. Also, it significantly downregulated 34 metabolic pathways. Now you've heard of metabolism. I have a slow metabolism, or I have a fast metabolism. I can eat so much because I have a fast metabolism. Well, 34 different metabolic pathways were affected by just these 9 days of inactivity. So what is that doing to your body, inactivity? So they said, well, how can we reverse this? What needs to be done? Because if it took 9 days, we're going to have them train for at least a month, and then we'll retest. So the young men trained and exercised for over a month. It only partly normalized. Even after a month of training, they still didn't get back to where they were before they started this 9 day of inactivity. What are the cells that it affects? Well, it affects the liver. It affects beta cells in the pancreas. It causes type 2 diabetes. It causes liver problems, kidney problems. It also causes atherosclerosis. You've heard of that. Plaquing of the arteries, which leads to stroke and heart attack and then cancer. What about this one? Listen up. It can also lead to Alzheimer's disease. I didn't know that one. Alzheimer's disease, that's a scary disease. Now, the question is, so what are you doing to avoid or inhibit or hopefully prolong insulin resistance? Exercise. You know, I hated exercise. I really didn't like it, but I started just walking about 2 or 3 years ago. I just walked. And I would be grateful and just walk a little bit, and then it added more and more. I don't know what it is going to be for you, but just do it. Just a little exercise a day. If it's interval training, if it's walking, if it's a resistance training, whatever the case, get out there and be able to prolong insulin resistance. This is the life tip for today. I'm Dr. Nielsen. Remember, live in fullness every day. I look forward to seeing you on the next life tip.